Terrence Lackren with the Vision Expo team, AKA the Optical Poet, and I want to welcome you all to today's Coffee Talk. Today we have an amazing discussion and an overview for us, but as always, I have a few housekeeping items to go over. Number one, as you can see, we decided to use the Zoom platform. Now, the reason why we decided to use Zoom is because it's nice, we have a little bit of a community feel to it. This is not a webinar, this is a conversation with colleagues. So we're able to see each other and talk with one another and really be able to benefit from the community feel. And in order to do this effectively though, we ask that unless you are a panelist or unless you're speaking, please keep your microphone on mute. So please keep your microphone muted at all times unless you are speaking as well. Now we do want to be able to ask questions. So if you have any questions during the discussion, go ahead and use the chat box down at the bottom. Or if you want to ask a live question and come on camera with us, go ahead and use your raise your hand feature and we'll then be able to unmute your mic. Now we usually have somewhere between 350 to 500 people on here, so we probably won't get to all of your questions, but we will do our best. Now for some reason, if we do get disconnected for any reason, just go ahead and log back in 5 minutes. Now, after 5 minutes, if you log back in and we're still not connected, you'll get a notice saying that we decided to postpone the talk for a different day. So with that being said, I'm gonna go ahead and shut up with my housekeeping and welcome you all to Coffee Talk. I'm very excited about today's panel. Talk about changes in office protocol post-COVID-19. We have an amazing moderator, Dr. Justin Bazan. Justin, how's it going?
Things are going fantastic, Terrence. Thank you for setting this up. Thanks to the whole Vision Expo crew. Hopefully, Vision Expo West will be here upon us sooner rather than later, and we'll see a lot of you guys in person to make up for the missed time that we missed out on at Expo East this year when shit hit the fan. Things went a little crazy in our world, huh? All right, so you know, cheers. This is Coffee Talk, but sometimes I wonder what they actually have in their coffee mugs. I'm not going to disclose what's in mine, but it's interesting that you had two options for us. You had Coffee Talk or a happy hour, and you gave me the Coffee Talk. And the four panelists that you have on here, I think would be much better suited for a happy hour crowd because that's where I know most of them from. And I want to introduce you guys.
Well, hang on. Before you go into Hey, Justin, before you go in to introducing the panelists, let's go ahead and introduce our guest barista. So the guest barista I'm very excited about. It's my best friend, no other than the glam optometrist herself. Ari, how's it going?
Hi, how's everyone doing?
Hey, Doc. Good morning, Doc.
Good morning from Southern California.
So Ari, why don't you go ahead and tell us who you are and what you are making for us today?
Okay, so my name is Ari. People call me Glam Optometrist. You can find me on Instagram. And quarantine has been pretty different for my family. My husband and I have both been home for the past 2 months. So in addition to raising my daughter, I have had to come up with different meals and food for her to eat and my husband. And so I started thinking about different drinks we can all have. So I came up with a pina colada, but it's a little different than what you would expect. So I'm going to show you that today. But otherwise, I also run a business called Glam Baby. It's a line of protective eyewear for kids, and I run it from my home. So 50 million kids are being homeschooled right now. So I launched Blue Light Protect for kids, and it's been doing great. So that's what's keeping me busy. It's my birthday today, so I wanted to make you a birthday. The version that I'm going to make you is virgin, but you can put whatever, pick your poison in there when it's done, okay? And this is the healthiest pina colada that you guys are ever going to make, all right? Are you excited?
Yes, let's get to it.
Okay.
Let's get to it.
Let's get to it. So I already cut everything up. Like I said, this is going to be a very different pina colada. And what I'm going to use is actually sweet potato and pineapple and oranges. That's it. 3 ingredients to make the pina colada. And then, like I said, you can pick your poison when you're done. I use a juicer here. Can you guys see it okay?
Sure can.
So honestly, it's the easiest thing to do. You just turn on your juicer and you put the 3 ingredients in. So I'm gonna turn it on. It might be a little loud, but we can, you know, have conversation while it's running. So in goes the sweet potato.
Skin on and everything.
Guys, this is a built-in table, and the table was falling because I didn't lock it. I'm gonna lock it.
By the way, everybody, Ari just moved into her new home a few weeks ago.
Yeah.
Nice.
So there we go. So this cool like table comes out of the drawer, which is awesome. I'm gonna move.
I have a question for the panelists already. What would be your poison of choice if you were making this pina colada?
Definitely not a sweet potato. I don't know, man. I don't make food drinks like that. I'll take some, you know, a nice peaty single malt. But if I am drinking pina coladas, it's usually when I'm chilling out by the pool or the beach, and whatever they put in it is good, and I'm down to drink it.
Nice. That's how my husband is. He's like, I don't care, whatever's in it. I'm at the pool, at the beach. Don't bother me.
Good philosophy to have.
Okay, I'm gonna turn it back on. I moved it. Okay, so I put the sweet potato in. And now I'm gonna put the orange, the pineapple,
Oh man, that's amazing.
smells so good.
It's amazing.
And this would be considered a breakfast drink, right? This is how you start your day?
No, I've already had breakfast. I've been up since 5:30. I have a 21-month-old, so we're up early here.
Wow.
I guess this could be my snack. I call it mommy juice. All right. So like I said,
That's one good thing about Ari. Ari and I can talk on the same coast time, even though I'm the East Coast and she's the West Coast.
right. So here we go. So a little story. Like I love pina coladas. And I love tropical islands. So for our honeymoon, we went to Turks and Caicos, and it's called the Heli-moon because there was a hurricane. So Hurricane Joaquin came on our honeymoon out of nowhere, and we were stuck in our room in the resort as like, literally we're like in our room terrified, and the furniture from our patios like getting swept away. And then you see all these like the workers downstairs like crazy running around, and then the only thing we could do was like order these pina coladas to our room. So that's
That's good. Well, all
and
right.
then this year for our 5-year anniversary, we decided to redo our honeymoon and go to Bora Bora. Well, that also is not going to happen because of COVID. And so my mom's like, can you please stop planning your honeymoons because natural disasters or like things happen. So we're going to have to take a rain check. If you guys have any suggestions where we can go instead of like somewhere tropical, like please let me know. Anyways, I put the little pineapple. So here's the pina colada.
Fancy.
Yeah, it's fancy.
Awesome.
Cheers.
Thank you so much,
Taste it.
Ari.
So good. And then it's
Really
naturally
appreciate you doing that.
There you go. Cheers.
Cheers.
Excellent.
Cheers.
Appreciate it.
Happy birthday.
Being on.
Thank you, thank you. All right. In the keeping with the theme, I want to introduce our 3 panelists. Putting this together, I wanted to make sure we had a good smattering of practitioners from across the country who could give us a sampling into their world and let us know what's going on and what they're doing to get patients to come back into their office and feel safe. And I think the underlying thing today is that we all want to make sure patients feel protected and safe. That's the one thing that they're looking forward to feeling when they're in our office, and we're going to talk about how we accomplish that. So first up to bat, I want to introduce somebody from the Dirty down south, Dr. Anith Pilai from Houston, Texas. And I already know what his adult beverage of choice is. And it's probably one of the weirder ones that I've ever heard. If there's anybody else out there, indicate in the chat panel if this is also your beverage of choice. But he likes to drink Diet Coke and Tito's vodka. Anybody else in the watching that broadcast favorite beverage of choice? Because I always tell him he's the weirdest guy I know for drinking that. But
Well, I have to edit that. It's actually Diet Pepsi.
Diet Pepsi, Diet Pepsi.
changed
My
Even
wife works
weirder.
for Pepsi, so
Even
Diet
worse.
Pepsi is the mix.
Diet Pepsi. But Anith, thank you so much for joining us today. I know you have a thriving practice down in Houston. I know you do a lot of specialty work, including your specialty lenses. And we're going to get some insights onto how you're opening up your practice. But let's just give a brief kind of highlight who you are and where you're at in the opening process.
Yeah, so I practice in a southwest suburb of Houston called Sugarland. We opened actually this week. Monday was our first day where we opened up to all patient care. We did a test run on Saturday, kind of a soft opening just to test all our protocols. We've been open the whole time for emergency cases only, but starting to see all routine care, all type of cases has really been this week. And it's been interesting to see how all the new changes have been not only for our patients, but also for our staff and how our doctors have been adapting to it.
Cool. Well, thank you for joining us. We're going to jump from the South all the way over to the West Coast. And we have whose social media handle is the Traveling OD. And Dr. Will Toe might be probably the only other guy that's in the air or used to be in the air as much as I was. Will has an established practice. He's a new owner to an established practice. And Will, tell us a little bit about yourself and where you're at in this whole reopening process. And thank you for being here, brother.
No, well, thank you for inviting me. Yeah, so my name is Will Toe. I'm in the Bay Area in California. Specifically, I live in San Jose, but I work in San Mateo, or my practice is in San Mateo. So it's a bit of a drive every day, but it's definitely worth it. We've been, just like Anith, we've been closed for routine care, but practice has been open this whole time during the pandemic for emergency and urgent care. So just, a couple of patients a day really on some days. Obviously it's, looking forward to things reopening up again. I'm really excited this morning because I finally got my PPP loan, correct this time.
Congratulations.
Official.
Good.
So finally, some good news.
This level has been...
Oh, trust me. Just a quick thing, just for all of you who, I didn't talk about this. Last week, I actually technically got my loan, but they messed up and they made a clerical mistake and they missed it by a decimal point the other direction. So actually my loan was 10 times higher than it should have been. And I was so tempted to just click accept and just move on from there. But probably not worth the headache and trouble if I took that $1 million+ into my pocket. But just excited to be back in action right now.
And we're excited to have you here. And last up, we're jumping all the way back to the East Coast, the Northeast, actually. And it's so hard for me to look at your name and not see the name that I know. But we have Dr. Chun AuYeung, but I know him as Chica John. So Dr. Chica, tell us why I know you as Dr. Chica and how can I modify your name so it says Chica John instead of what I'm seeing right now. But thank you for joining the panel and give us that little insight into how you got your name that we all know you by.
Well, thanks for having me. The name Chica came from University of Florida. When I was in college, I was a hibachi chef. So I was cooking in front of people. I was cooking for about 5 years in college to pay for a lot of bar tabs. And after a while, the customers usually just loved me and they asked for that Chica chef. Because every time I would do the egg roll or scrape the grill, I would go Chica, and they're like, "Hey, can I get that Chica chef?" So
that's awesome, man.
Yeah, that traveled from University of Florida to Nova to up here and to New York. It seems like.
So do your patients call you Dr. Chica?
No, they haven't, but not yet.
Not yet. Thank you for coming on to the broadcast. And I know that you are representing the new practice owners, and your practice now is 2 years old?
2 years old, yep.
2 years
brand
old.
new.
And where are you at in the reopening process?
Just like Anith and Will, we've been open ever since the lockdown for emergencies. I live 3 miles away, so in case the televisit didn't work out very well and I need to see them in person, I can come in. It takes me like 5-8 minutes. So we've been seeing medical throughout the whole time. But as of this week, we're open to routines. but we reduced hours from 10 to 4, kind of like what Anith said, kind of slow opening. But next week, we're going to go full force.
All right, that's awesome. So we do have, practices at different points. The first item that I'd like the panelists to discuss is, for those of us who have been in lockdown, what's the first thing we need to do to get the message out to our patients that we're there for them, that we are seeing whatever type of care? How did you guys go about that? What worked? What didn't work? Will, do you want to kick it off and start us out with here?
Yeah, well, for us, I think one of the things that was really important is that we maintain communication with our patients the whole time, not just now that we're reopening. So obviously a little bit too late for some people who haven't been doing it. But the idea is, with everything that was changing with the pandemic, literally you could make plans that morning, and by the afternoon, so much had been updated that half of what you planned and was obsolete. So you really being on top of it as a healthcare provider was a big deal. And I think it was really important to communicate that to the patients as well too. They're seeing a lot of information on the news, which may or may not be correct. They're seeing a lot of information from politicians, which may or may not be correct. But your role as their healthcare provider is to be that source of education and correct information. So I actually made sure to stay in communication, e-blast, social media with my patients about once a week throughout the whole time, just giving them updates saying, this is what's going on. This is what the CDC recommends now. This is what's safe. This is what's not safe. Okay. And then all the links, everything I said would have links to the CDC so that, so it would basically give them the exact source of all my information. And I would do that consistently so that now that things are a little bit more normal and that we're reopened for routine care, that it's, it was all, they already saw me as that leader in terms of giving them the correct health information. And now that it was a simple message of, hey, we're still going through it, but CDC has now allowed us to reopen for routine care, AOA, COA, the county. Let's get started, but we're going to slowly ramp it up. So it was just, that constant communication with them throughout the whole thing. And now it was really easy to just roll it over into, now we're getting a little bit closer to business as usual.
So that's excellent. I heard you kind of had a faucet about a once a week message going out. Anith or Chika, did you guys do more or less than once a week with communications? Yeah,
so we did less. It's funny, I probably did a lot more of my social media for my practice when we were up and running pre-pandemic than when we had time. And I think it was just more that I wanted to collect all the information, kind of with what Will was saying. Things were changing so fast. I didn't want to put out a message till I was pretty much ready. And I knew, okay, this is what we're going to do in our office. This is how we're going to implement it, until I had a plan. And during those first few weeks, I really didn't have too much of a plan. And it took a couple of weeks just to get used to that and saying, it's okay, I don't have a plan yet. I want to learn more about what I'm going to do. And then I really sent basically 2 strong messages that were through our social media and an email blast, basically saying, we're open, we're seeing patients, and this is what we're going to be doing. And then once we kind of rolled out, we started hitting a little bit harder. So I did a little bit opposite of Will. I don't think either way is wrong, but I wanted to kind of have all of my answers, or as much as I could get, prior to sending out too many messages. The other thing is we were just busy. When we were quarantined and shut down, it seemed like we were more busy. We had so many meetings coming up, and we were doing all the work our staff was normally doing. So there was a lot of other things we were taking care of the clinic besides just kind of communication. But I would say once we got ready, probably a few days prior to us doing our soft opening and definitely our real opening, that's when we really sent out email blasts and social media posts. We also have an A-frame right outside our practice, kind of going over what our protocols are. And we send out messages to every patient when we confirm them about what to expect when they come in.
Chika, and I'd like to hear from you what message you felt was the most important one to get out to your patients.
The email blast. In our state, last week, May 7th, our governor said we were able to see routine exams. So that day, I actually sent an email that we are open to routines starting Monday. So that I blasted an email through MailChimp. So all my patients got the email. And just like Will and Anith, we also sent an email during the lockdown that we were still open for medicals and routines. Our website was updated with a COVID a notice and a televisit button. But the biggest message was when we send out those blast emails like they did before, during, and now when we are open for routine care.
One of the things that
I'm sorry?
Go ahead.
Like Will said, just keeping them updated the whole time, not just, oh, now we're open, so just keeping them informed the whole way.
One of the things that we found was important is we listed the type of care that we were providing. And when we sent that blast out, we made sure to include a link to the online scheduler. I think I sent a blast out at like 10 o'clock, and by midnight, 1 o'clock, I already had over a dozen people making appointments for that type of care. So I think that there's one of the things docs are worried about as they open up is if there's going to be any patients to see. And from what I'm hearing, and you guys can back me up on it, is that there is going to be a backlog of patients who are in need of care. And we're just waiting to hear that their type of appointment is now available. The other thing that we made sure that we did include is we said the office is going to run differently now, but it's running differently in ways that are going to keep you best protected, right? So we're putting safety first. It's of the utmost importance to us. And here's the top 10 things we're doing to ensure your safety during your visit. So maybe we'll cover like 10 or more, but I want to go back to what that looks like in your office. So I'm a patient, I made an appointment, I'm showing up to your office, I'm at your front door. What happens from there? So I'm the patient, walk me through what I'm going to experience and highlighting what's new about the patient experience, starting from the front door. So, Anith, why don't you walk me through the front door of Revolutionary Eye? I'm here to see you today. I'm standing at your front door. What happens next?
So our patients actually get a message through Weave to text us when they arrive and to stay in their car. It's also on our A-frame right outside. So they stay in until the room is sanitized and prepared for them. During that time, if they haven't already, because they get links to do all their online paperwork, but if they haven't, that will be the time where they can send in insurance cards, IDs, and then fill out any HIPAA forms they haven't already done so. And there's a COVID questionnaire on that link as well that we updated through our Crystal EMR. Once that's done and the rooms are ready, then our staff unlocks the door, they let them in. Staff is wearing masks, face shields. Patient is asked to come in with a mask. If they haven't, we provide one. Their hands are sanitized right when they come in. We do a non-contact temperature check. And then we do a non-contactless payment method. So we do have text to pay with Weave, but also most of the time patients are just reading out their credit cards and we're just using a virtual terminal. Then they're taken straight back to whichever patient room they need to be in, whether it's a pre-testing room, whether it's a special testing room, or straight to the exam room. We are limiting just the patient into the office unless they're a minor, which one parent can come in. Each area of our office is limited to one patient. So we can have one patient in the optical, but another patient in the special testing, or another patient in one of the exam rooms. So we have 2 exam rooms, special testing, a pre-test, and optical, and a vision therapy room. So at most, we could have 6 patients, but to be honest, we probably had never more than 3. And once a patient's done in a room, then our staff is actually checking each hallway, each entrance to make sure it's cleared and nothing else is going on, and the next room is already prepared for.
Excellent. That seems very well thought out, and me as the patient would feel safe doing that. Chica John, I'm at your front door for an exam. What is my experience going to be?
Well, just like Anith said, all our forms are going to be electronic, pre-filled already. It's already been handled. So when you come in, our doors are not locked. We have 2 doors, but one of them is locked, but the other doors remains open. And we actually have a dispensing bar that we moved from the side to the front of the door, where we have like COVID notices, our office policies, hand sanitizers, and masks. If a patient comes in without a mask, they are provided one, and they need to wear a mask.
What happens if a patient says, you know what, I'm not wearing a mask, you can't make me?
And I said, I'm sorry, this is our policy. We'll be like, turn around.
Okay.
I like to take this one because we're in Texas, and we haven't had it yet, but I know it's going to happen
down
for
there.
sure. I know it's going to happen. So we've been kind of saying, we've been putting it, hey, we hate this protocol too. It's for safety, but we're just following guidelines. The staff puts on the doctors, hey, we don't like wearing all this. We just have to do this right now because it's necessary. The doctors just say, well, it's the AOA CDC recommendations. We have to follow that. And if they're refusing, say, that's no problem. We completely understand that. We'll be happy to reschedule on a day where we can go through a different protocol for you.
That's great. Will, I want to shift it over to you. And I'm hearing a lot of similarities. I think that the industry is getting almost, I don't want to say a standard protocol, but there are a lot of similarities between what we're doing. We're doing as much as we can beforehand. Things are done in a non-contact way. We're wearing masks, we're sanitizing hands, we're directing patient flow, we're isolating. Will, is there anything that we have missed or that you're doing in addition when the patient shows up for an appointment?
I mean, yeah, I mean, it's pretty much very similar to what everyone's been, what was just mentioned. I mean, we also, lock the doors. We're doing all these, checking symptoms, checking temperatures before they walk in. Everything's by appointment only, no walk-ins, no, even the optical. If you want to see an optician for an adjustment, that's still appointment only. We're really trying to limit it to really just a couple of people in, a couple of patients in at most at a time. I think, there are a lot of good conversations over the last couple of weeks about these kind of things. And I think you're right. People, I think, understand at least at the minimum what they should be doing. For me, I wanted to take it a little bit further because, I understand that, despite what's going on, even if you follow every single safety guideline out there, a lot of this is going to be fear driven more than anything else. So I don't mind going a little over the top for these kind of things just to give my patients and my staff a little bit more peace of mind. So, whatever materials we need in terms of equipment, things like having a diaton and eye care versus the NCT, just in case. I purchased scrubs for my staff, multiple sets of scrubs for all my staff, just to give them a little bit more peace of mind, like, that they, if they're worrying that, they can get some of the virus on their clothes and things like that. Masks obviously are free for everybody. Custom ones too. I just made some fun. I had some fun ones made, different designs to make it a little bit, give them a little bit more peace of mind and comfort. Things like that, I think really matter. Like, it's not just because we have to because of guidelines, but really it's, we're at a point where we really have to make sure people feel safe and comfortable. Not just that they are, but they feel it too. And it's really hard to quantify or qualify that because how do you judge someone on how they feel? So you really, for me, it's like, it's better to go over the top than to do just enough to get by. I think that's a big part of our responsibility as, as the boss of the practice to make sure our staff feel comfortable, not just are safe, but actually feel safe and feel comfortable as well too. So we're trying to do everything we can following every single recommendation, as long as if it makes sense. I don't mind spending a little extra money just to make my staff feel better.
That reminds me of a great point. Where do you guys go to get information that is from a reliable and truthful and validated source? Is there a website that you guys have bookmarked that you return to because it is an excellent reference that you can trust? For me personally, I've been going to the CDC website a lot. And the AOA also has reopening guidelines, which I found extremely useful. But the CDC is where I'm going for my information about what I need to do to make sure that my office is following protocols for infection control, right? So standard protocols and droplet precautions, and those are found on the CDC website. One of the other things that the CDC website has, and I've listened to a lot of broadcasts, but nobody's brought this up, is the CDC has a whole section dedicated to finding out whether or not the most important piece of PPE equipment that you and your staff are wearing is actually legit. Does any of the panelists know what I'm talking about?
Yeah, I believe they have markings to show whether you're 95 mask, for example, or KN95, if the markings are actually what's regulated by the government, if they're, for lack of a better phrase, if they're legitimate.
Yeah. So there's a on CDC. If you type in counterfeit N95, there's going to be a whole guide that helps you figure out the mask that you're putting on your face or your staff's face is actually a legit mask. I think, even if it wasn't a legit mask and it was bootleg or counterfeit, it's still going to serve the purposes of at least being a cloth mask. But the whole point of having an N95 respirator, it's the highest level of precaution and protection that we can have. And as a provider who's going to be in close proximity with patients all day long, I want the highest level of protection, as do for my staff. So I encourage you guys to go to the CDC website. It's a plethora of information, but also make sure that you are using that guide to understanding whether or not the supply of mask that you have purchased is legit or not. So you understand what level of protection you have. That also brings me to the next point. Where the heck are you guys getting stuff? Because it's been so damn hard to find proper PPE. Who's got a good source that they're probably not going to want to share because then their source is going to be used up? But who's got a good source of where I can buy necessary disinfection supplies and PPE for the office?
My partner and I, we got a lot of it so early on where we went back to some of these sources, and he had some links that he kind of took charge that don't even have a lot of the supply left. We do have a medical supply store right across the street from us, which we can go to,
nice.
which is nice. If anybody's seen any of my posts on social
He's so
media,
lazy though. He still
masks,
tries to order it from Amazon so it gets delivered.
yeah,
That's how
our
lazy
face
he
masks
is.
are from Amazon actually, but that it serves its purpose. There's a lot of links that I get from colleagues from our local societies, state societies, that have connections or have links to sites where you can get PPE. But one thing I would remind everyone is just like what Justin said, just make sure it's legitimate, make sure you're verifying it, make sure you're checking it that you're getting what you paid for.
Right. Yeah, I would actually highly recommend to everybody too to, if you ever notice if you've been trying to buy medical supplies on Amazon for the last few weeks, that a lot of things are unavailable except for medical clinics and hospitals. You'll say that little disclaimer on the bottom. You should find out. I know it's actually state by state, so you have to find out specifically if you can sign up your Amazon business account as one of those, as designated as a medical facility, so that you can actually have access. You need
a group NPI number. So the qualifier, the gatekeeper, is a group NPI number. Now, I believe they probably check to see if your group NPI matches the business. But then that does give you access to the COVID-19 supplies. However, who's been on that lately? That supply source, which was supposed to be just for healthcare providers, is actually pretty dried up too. So,
yeah. I got I'm sorry, we've got our mask through early on as well, but also my cousin-in-law also has a medical practice, so we got a lot of masks from him. And then through some colleagues, we got a bucket or a couple gallons of alcohol sanitizers from a distillery. So nice. Check out your local distillery, pick up some bottles of alcohol sanitizers.
Is that throat sanitizer? Is that what that's called?
Yeah, everywhere, so.
I would not recommend you drink it, but if you're really desperate enough, you can.
You can make a good pina colada with it.
Just add a little Diet Pepsi in it, it'll be fine.
Yeah.
So actually, no, that actually has been a pretty big thing. I think a lot of distilleries, good for them, have changed their manufacturing to hand sanitizers. It's not the gel, it's the liquid kind. But I think that's a really great thing. And, it's some of them are just giving it away to hospitals so you can't access, but some of them are selling it and shipping them to wherever. So in limited amounts. So I would definitely take advantage of that.
Wow.
If you can't get it.
That's it.
That's a lot.
The other thing to check for, depending on the county you live in.
Sanitizer? I'm high?
Aim high.
Oh, aim high. Okay, never mind.
One thing I wanted to
Well,
mention,
certain states.
depending on the county you live in or the city you live in, a lot of local town and local city governments are providing PPE for healthcare workers.
Oh yeah.
I live in Fort Bend and near Harris County. Unfortunately, they're asking for donations, but if it's in a smaller town or a smaller county at least, they may be able to provide whether it's surgical masks, N95 masks, face shields. I know Dr. posted about that they're getting face shields from their local counties. So that's maybe something worth looking into.
That's a good one. I'd second that as well too. I've heard a lot of the, unfortunately not the county I'm in, but a lot of the counties in the Bay Areas, and I assume the rest of the country, contact specifically your EMS department. And that's the one where you put in the request and they'll let you know if they have some available, or if you're in a hot zone, they probably won't have any available, but you can get several hundred masks, both the surgical, the N95, and face shields as well too, for free from the county, because you are a healthcare provider. So double check that. I would do that immediately, because obviously they have limited supplies, but specifically the EMS department of your county.
Guys, I know we're getting a lot of questions coming in, but I want to give this opportunity to put you to the front of the line. So if you want to jump to the front of the line to have your question answered, you only got to do this one thing. You got to raise your hand and be willing to go live with us and ask your question live. So I'm going to give you guys 10 seconds. If anybody wants to ask their question live and direct right now, go ahead and click the button down there, raise your hand, or indicate in the chat that you want to go live. And then Terrence, you're gonna go ahead and unmute them and let them go live.
Absolutely. So far, no takers though.
Any takers? Raise your hand. We see Julie. Terrence, do you see Julie raising her hand down there? Julie?
We do not.
All right. Is there a raise your hand button that they can press, or should they just?
There is actually. You go into participants, and
all right.
You hit participants at the bottom of your screen. It should say more. You can hit raise your hand. There we go. We have one here from Jaya. I'm going to unmute her or him.
Hi.
All right.
Hey.
Hey there, Jaya.
Hi. So, sorry, I'm coming to the office with some supplies. So, do you guys have like a square footage that you're allowing a certain number of people in terms of in the office, because you've got to deal with the staff too? So.
Yeah, that's a great question. I'll start this one off. I'm in New York City. I have extremely small office. We're working with about 800 square feet. Right now, we've cut staff all the way down to one staff, one doctor, one patient allowed in at any time, which allows us to maintain proper social distancing as an extra precaution. That also includes one guardian if the patient needs a guardian with them. So, we've cut it down to the extreme end. As we open slowly back up, we may expand that to at least, an optician and potentially a tech. But right now, I guess the main thing is we're cutting it down to just that patient and a guardian in, which works for our space. Will, on the other hand, you've got a big ass office, right? What is your staffing look like, and what do your social distancing look like in your office, and what's the square footage and what's the staff?
Well, mine's definitely a big practice for maybe California and New York, but definitely not big practice compared to some of the ones in the Midwest, I'm sure. But a good criteria that I've actually heard that some counties have adopted for not just optometry, but for in general, is if you know what your max capacity is for your particular building or your particular office, you should be not exceeding 20% of that, if you happen to know that number. Another way to do it is for every 100 square feet that your office is, you can only have a max of one person per 100 square feet, counting yourself and your staff as well. So if you have, Justin, you said you have 800 square feet. So if you have 3 employees and yourself, that's four people. That means you can have no more than a max 4 additional people in that practice at any given time. And I think that was a good benchmark. When I read that kind of made sense. So either one or the other, 20% of whatever your max capacity, if you know what that is, or one person per every 100 square feet.
Yeah. John, what are you doing?
Since we're new, we only have one exam lane that's really outfitted. Right now, we only allow 2 patients in the whole office, including our staff of 2. So total, the whole office would be 6
And that's
Yeah, so we don't go by our square footage or occupancy. We really went by our rooms. We have over 2,600 square feet, so we wouldn't allow that many patients in at once. So like I said, we have 2 exam rooms, a VT room. We consider optical a certain area and special testing, and they're all different areas. So 1 patient per room, and where they're not ever interacting with each other. That's how we went about it.
Got it. All right, so let's jump back to the patient experience. I'm the patient. I just completed check-in. I'm ready for pre-test. How do you make me feel safe during pre-test?
I'll take that. Before the patient even enters any room, pre-test room or the exam room, my staff cleans everything before they even sit down, from the equipment, the chairs, the tables, the pens, the mouse, the keyboard. So my thing when I tell my staff is, when I go into a room, if I take my mask off, if I do, I want my nostrils to be sanitized. That's how I want the whole room to be clean and smell. So
what's the difference between cleaning, disinfection, and sanitizing?
So sanitizing is literally physically removing germs, whereas in disinfecting, you're actually killing germs with like chemicals, like bleach, alcohol.
So what's cleaning?
Cleaning is just literally just scrubbing your hands. It's just as well, but doesn't actually physically, chemically doesn't kill the microorganisms.
Okay. I heard that cleaning with soap and water does do that.
Right, but that's literally physically cleaning it, right?
Semantics. I'm just breaking your balls, brother.
Right.
But there is a difference between cleaning and knowing that you're actually killing the germs. One of the things that I've learned from being on the CDC website is there's a whole new category of disinfectants that are on an end list. So they're not proven to kill coronavirus. However, they're or coronavirus SARS-2, which causes COVID-19, but it has killed a similar or tougher virus, right? So it's a whole list of products that you can put your name in. Let's say you use Clorox disinfectant wipes. You type in that name and it should pop up on that list, and you know you have a true disinfectant wipe. Different than a cleaning wipe, which may remove grime, but not necessarily disinfect the surface that you're using. So I just want to put that out there, that if you are using disinfectant products, run it on the CDC's list to make sure that it does meet or exceed those qualifications. So we talked a little bit about what Chika does to help make the patient feel safe during pre-test and in the exam. Is anybody going above and beyond just a general surface disinfection with either a liquid spray or a wipe?
I have a UVC lamp coming.
Okay. Talk to me about that, because UVC, the studies are out there, the science is behind it, but what I have a hard time, and I'll show you right now. I mean, this is, in theory, this UV box, you know, will disinfect whatever the light comes into contact with on the surface, right? So this is, in theory, going to disinfect things like frames or my N95 respirator. However, where I have a huge problem with it is I don't know if it's actually a disinfecting germicidal UVC bulb in there, right? There's a lot of videos on YouTube where people have purchased UVC lights, tested them, which we don't have the test equipment for as, you know, lay individuals. You know, this guy's a professional lighting or electrician, and it was complete BS. So how do I know if I'm going to be able to use that or solely rely on that for disinfection purposes, whether it's the exam room or whether it's equipment or whether it's things like our products, such as our frames?
So
Any of the panels?
It's just one of the additional things that we do aside from sanitizing, slash disinfectant slash cleaning. It's one of the extra steps that we're taking.
Extra.
I've heard from other colleagues that when you do use a UVC lamp with the face mask, it actually relieves actual smell to it. So that tells her that's actually working. I'm still waiting for my lamp to come in, so I have to test it out. But again, that's an additional step. We do not know how to kill COVID. Like COVID is still a very, very novel virus, so there's still a lot of things that is saying that approved to kill. So it's still in process for many things, right?
Yeah, I think we're still learning a lot, right? I mean, what we thought could kill it a month ago is definitely different from what we know now. And who knows a month from now what things will be. I've heard mixed things about UVC myself. I mean, I understand that, that if you want to be extra safe, just in case, add that other layer of protection. I would not use UV alone to replace some of the other recommendations, like the hydrogen peroxide, alcohol base, all these other different things. Because yeah, I think, like I said, you would get definitely a little bit more, helps with peace of mind for staff and for patients to know that you're adding that protection. But yeah, I have heard mixed things about it. So from my reps and various articles. So I don't want to, I would just caution people to just using UV sanitation as your only method.
Yeah, we haven't incorporated it into our office either, but it looks like there's someone that wants to chime in about UVC.
So we have a few people actually here, Justin, that are raising their hand. I think Janie had her hand up for quite some time here. So Janie, let's unmute you. We can have you ask your question.
Hi,
ahead,
can you hear me?
Yep.
Hi, my name is Janie, and I work in the eyewear industry, of course. I saw a question written a little bit above here about how, if you guys have opened, how you're actually cleaning the glasses, whether it's an optical frame or a sunglass that a patient is trying. I just wanted some clarification on how you're cleaning the frames.
Sure, I'll field that one first. Soap and water is a proven way to do it. It just happens to be, it's a pain in the butt, especially if you got to go through a whole bunch. It's not quick and easy. There's also a myth that if you're using a prep pad, and in my office, this is probably our primary mode of disinfection. It's 70% alcohol in a prep pad. We also have a larger Sani-Cloth with germicidal, a germicidal wipe. But you can test out on your frames, and it's specific to material. But if you're testing an inside temple and you're rubbing that on there, and you can see if it's causing any damage to the frame. But just to do this live, I have no problems taking a 70% alcohol prep pad to frames and disinfecting them, and just letting them air dry after that is a quick and easy way. Right? So there's the myth that 70% alcohol is going to damage or disrupt your frames. It does not for this particular material. Your results may vary, but give it a little test on the inside, of a temple, and see if it's okay for that particular frame material. And if it is, that's a very quick and easy way to get it disinfected. We're also throwing them in the UVC light box as well too. But that's what we're doing. What are you guys doing on the panel?
We're doing the same thing with the alcohol pads, and then quickly we wipe it down with a lens spray as well, just so it doesn't really destroy the frame.
We're using soap and water as well. So patients aren't touching anything on the optical. They're handed it to our staff. That's kept in a tray, everything that's touched. Then after the patient leaves, we have fresh soap and water solution that they're cleaning with, and then set back, air dried, and then put back onto the optical.
Yeah, we're using, similar thing, alcohol-based or hydrogen peroxide-based to clean all the frames. Anything that even anybody touches, or we feel like even if they get too close where they might have, accidentally touched it, it's just not, it's just really easy to clean afterwards. I think, can we actually see if we can get Tracy up on here?
Yeah, I believe she wanted to talk about UVC.
There you go.
Hi, everybody.
Hi.
Hi. So my husband's actually a research scientist for Roche Molecular, PCR guy, but he went to Stanford and uses UVC in his research labs. And I've recommended to everybody to do a lot of research on it. One, they use it for their goggles. They also keep it on overnight. It does destroy a lot of plastics in the labs. He's not at his research lab until the end of the month, but he was going to bring some plastic back to me. My husband also says that all of the nooks and crannies, just using a UV light, and if you look at all of the research, it's not going to do a good enough job on a lot of our frames. But the biggest issue, and if I also had chemical engineering background, is look at UVC with cellulose acetate. It's an organic material. So if you guys keep putting your frames into a UVC box or something, over time, you're breaking up the bonds and you're going to make those frames much more brittle. And, you know, granted, I hear lots of doctors, oh, it looks fine right now. Yeah, it looks fine right now, but is it going to look fine 3 months, 6 months, 9 months down the road, or 2 years down the road? So you just took the cellulose acetate frame that could have lasted 10 years if people took care of it, and you've just...
Might not be a bad thing.
That's a different conversation.
Yeah.
So question I have for you is, how can I...
one later.
Right.
How can I make sure the UVC light that I get's legit? That's, I think, is my biggest concern.
Right. That is another thing. My husband says the UVC lights they use in the research lab are left on for long periods of time. And these little wands and stuff, he thinks it's all snake oil. We've had many, many, many talks about this. He pulled up some data for me. I sent it off to some of my customers that I work with, but it's not. Regular soap and water breaks down the membranes on COVID. All of the manufacturers for cellulose acetate recommend hydrogen peroxide at a 0.5%. So you take your 3% hydrogen peroxide, mix it with 5 parts of water into a spray bottle. You spray it on the frame, wipe it down wearing gloves, and then it air dries. That'll break down the membrane as well and sanitize it. So, and that is what we're utilizing to sanitize all of our frames and not destroy the materials. I mean, all the other stuff, use those UV things for your phone, but I would not use it on cellulose acetate. It's just a recommendation. I really think you guys might be ruining it, especially in the luxury industry. If you're in low end, not a problem. But if you're dealing with luxury frames, which is the segment of the market that I work with, I would not recommend it. Okay.
I think that's excellent advice. Thank you so much, Tracy. All right, let's move along to, hey, your staff and your doctor, you guys look different. You are wearing some types of equipment, PPE, that the average person may not have walking down the street. Who wants to address that? When you see me, I may not look like me, and explain a little bit about the PPE that you're wearing and when it's appropriate to wear and why you have it on. Anith, you had a face shield on yesterday. Talk to me about that.
Yeah, so in our office, our staff and the doctors are wearing masks, face shields. The mask was the big thing. We knew we wanted that, and we wanted our patients to wear it. The face shields we got just as an extra layer of protection. We're testing it out. We didn't know how it was going to work, doing slit lamp, PIO, how my partner's going to do vision therapy, low vision evals with it. So far, I've been okay with it. We wear it during patient care. So I'm in my doctor's office right now, and I'm not wearing anything. But when I go out into any of the hallways or interact with any patients, I'm wearing all that stuff. I was able to do slit lamp. I was able to do BIO. I was able to do 90. I was able to do everything with it. It was tough for sure. One thing that's helped with the face shield is I do have an adapter for an anterior segment imaging. That helps a lot with slit lamp. We do have ultra wide field imaging, which is great also. So using technology helps a lot with stuff that we're doing now with the extra layers of protection. But, you know, knock on wood, so far, all the extra stuff we're wearing hasn't caused too much of an issue.
Now I can give you crap about, you know, you don't really need a face mask if everybody is masked up and you're not doing a procedure that's generating any type of splash danger, because we know this is spread through respiratory droplets primarily. But I'm not going to do that, and I don't want to give anybody crap about giving what PPE that they're utilizing or disinfection methods that they're using, because I think that it's of the utmost importance that you do what you feel you need to feel safe and what you need to do to make your patients feel safe. So while I may not use a face shield 99% of the time in the office, I want to make sure that everybody, you know, understands that it's allowable to do what you feel is appropriate, and we should not be putting anybody down about any procedures that they're doing, because I've seen that going on.
And I think, well, the other thing is a lot of this is also just so our patients feel safe. You know, even if I was just wearing a surgical mask, you know, that may, from what I know, just scientific, that's probably all I need for protection. But having all this extra care, patients have felt pretty comfortable with it. And I'm not going to make them wear a face mask. I'm saying, look, we're making you do this, but look how much extra we're doing. So we're going through it with you. And so far,
now Will is known for wearing gowns, but are you using them in the office with your patient care?
I'm not using gowns.
You know, the one thing I do want to add on top of that too is it's important to understand that everyone's access to PPE is very different everywhere. That's one reason too. So if somebody is just using, you know, surgical masks and not, you know, N95s, like for myself, you know, in Santa Clara County where I'm at, or just in the Bay Area, you know, we were one of the hot spots. We weren't New York City, but we were one of the hot spots. So, you know, N95s are still relatively hard to get. Surgical masks have been a lot better over the last week or two than it was a month ago, but it's still really hard to get the N95s. So, you know, for me, it's also a case of the more N95s I am keeping in my office, the less the, you know, hospitals and emergency rooms in this area have access to as well too. So it's something to keep in mind. I'm not going to judge people on that either because it's just different. You know, I have doctors that, you know, are using cloth masks working in hospital settings, you know, in a department next to COVID patients because they just have nothing. They have, you know, they have nothing else. So it's like we're all in different situations. You know, I have a lot of things that are on order currently. You know, I'm using the blue surgical masks, scrubs. You know, like I mentioned, I got from for everybody, which, you know, I'm changing in when I get to work, changing into the scrubs, changing out of it, putting into a bag, and then, you know, washing it so it's not coming in contact with like my car and things like that in case I get anything on my scrubs. But yeah, so basically that's what we have right now. Everything else is pretty much on order. So I'm still waiting to, you know, I do have a small handful of N95 masks, but because I only literally have like 5 of them, I'm not gonna, you know, I don't want to just use them just to use them. Kind of saving it for more situations where I'm potentially working with a high risk patient, you know, and so I have the N95 available and not to waste it too early. So yeah, so basically kind of what Anith is doing, a little bit less because I don't have shields quite yet, but I'll probably be using them once they actually come in.
The other thing I found, the more I cover my face, the more compliments I've been getting on my looks. So.
Chicken John, can you share with us how you are, if you are using an N95, how you are preserving that? Because we know that, you know, there's not an unlimited supply, and if we can find a way to make it last, how are we doing so in a safe way where we know that we're not putting back on a mask that's potentially infected with coronavirus?
Right. So no face shields on my end, but I am using the mask, and I reuse them about 2 days, and then I rotate them, right? And then once I get that UVC lamp, that's going to go in the same room where I'm disinfecting my room with the UVC lamp, or with my white coat and my face mask being disinfected for like 30 minutes. And then 2 days later, I use a new mask to kind of preserve. And then use the cloth mask. But like Will says, I do not want to tie up all the resources where the nurses and hospitals that are finding shortages to find those masks. So I'm pretty much reusing the mask 2 days in a row, and then I rotate to give it some time to kind of die off, I guess.
Yeah, so we know from a few different studies that the amount of time that the virus lives on different surfaces can vary. I think that there's generally an understanding that it could potentially be up to a few days on materials, cloth materials, fabrics, or surgical masks, or even the N95. So having a rotation where you have a couple of days at least in between that mask is awesome. Adding a layer of disinfection. There's some different methods out there too. If you go to the CDC, again, I'm referencing CDC. The CDC also has some links to methods that they have for reusing a mask and disinfecting a mask as well too. Again, it's an excellent source. Or contacting the manufacturer. Right now, certain manufacturers like 3M are doing studies with certain types of disinfection, whether it is a steam-based one, a heat-based one, a vaporized hydrogen peroxide, which probably don't have access to, but we're learning, right? This is an emerging area. So a good thing to do is tune into broadcasts like this. And also the CDC has been an excellent source. Time is actually flying by. We're actually at 1:15 here on the East Coast. I want to make sure that questions that we have been receiving here this whole time get answered. So Terrence, do you have potentially a few questions that we can throw to the panel that you've seen that might be of high interest or have been repeated in the chat?
Yeah, Justin, you know, one question that's come up a few times is about how do we get, for patients who are wearing masks, how do we prevent the fogging, whether that's through the exam or whether it's even with their actual lenses. So any thoughts on that?
I think that's an important point to understand too. First, with fogging of glasses, right? We've seen it on our own glasses that we wear with our masks. Patients complain about it. There was a Bausch & Lomb sent out a newsletter about a month ago that talked about how doctors in Wuhan were having trouble because their glasses were fogging up underneath all the PPE that they were wearing, right? There were multiple gowns, multiple masks, shields, things like that. So a lot of frontline healthcare workers were having very much difficulties with that. So, you know, a big thing, obviously contact lenses, you know, is I think a huge thing that we could be recommending for all the people wearing masks. You know, as far as, you know, the CDC, you know, I know there was some controversy and people were wondering whether contact lenses are safe to use during this time. And I think it's found that as long as you maintain proper hygiene, you know, washing your hands before insertion removal, that it's safe to use. So I've been really advocating for contact lens use for patients all across because of the Bausch & Lomb article or newsletter that was sent out. And that's been pretty big, you know, getting patients to try out contact lenses who've never had it before. And so they don't have to deal with fogging lenses.
Get those multifocal contact lens fits done, right?
Sure. Different subject there we could talk about. But not only that, but yeah, obviously we have the same problems, not just with our glasses, but our actual lenses, you know, our 90D, you know, when we're doing our 20s, when we're doing BIO. And that's been a problem. You know, I've not found a good solution myself without potentially putting something on the lens that could damage the coatings on it. I know there's a few things that you can put, but I'm hesitant to do that myself. I've just trying to do my best to, you know, adjust my mask or, you know, have the patient, you know, tape the top of the masks just temporarily. Make sure you use like medical grade tape and not just regular tape, because that can, you know, irritate their skin. But things like that to use kind of temporarily, you know, I don't know. I'd love to hear from the rest of you guys if you guys know anything that you can potentially put on our, you know, our lenses, our Volk lenses, that wouldn't damage the coatings or the lens itself.
I haven't had too much of an issue with fogging yet. I know there's these anti-fogging sprays you can use, and I haven't used it on my lenses. Looks like there's some people talking. OptiFog was one that was mentioned in the chat. Those things could be helpful. And also I've been leaning a little bit more on technology, using imaging, anter-seg and post-seg. Not going to get into debate of, you know, should you do retinal screenings, et cetera. I'm just saying if you have the technology, this is time to lean on it. You know, this is where you can really use it to your benefit to supplement your dilated exam, your retinal exam, and your inter-segment exam if you have inter-segment video.
Actually, yeah, to just add on to that, I think there was a couple of weeks ago, a webinar with Dr. Richard Hom, where he mentioned, you know, in terms of
Richard's
safety.
on the broadcast. Thank you for tuning in, Richard. Good to see you.
Oh, hey.
Yeah, he mentioned
great.
using retinal imaging as at least a temporary replacement or I guess substitute, you know, for our low risk patients. Obviously, if somebody has flashes and floaters and they're diabetics, we want to dilate. But if you can postpone the dilation, you know, and not keep the patient in the exam room or in the office as much as you can, you know, I'm very comfortable with a low risk patient doing retinal imaging, like an Optos or whatever device you may have, and then maybe scheduling a dilation for a month from now, you know, assuming everything's okay and that they're low risk, because it's just, you know, some things, especially if you're in a high risk area, it may not be worth endangering them or your staff if you can postpone that dilation just a little bit more, you know, like I said, as long as you're comfortable that they're low risk. So yeah, you're right, Anith, utilizing technology right now, you know, not to lower our standard of care, because that's not something that we definitely want to do, but if certain things that can be postponed a little bit, we should definitely try.
Yeah, and on technology, oh, sorry, go ahead.
One of the things that I've heard over and over again is the phoropter keeps fogging up. There's a forehead rest that adjusts the distance on the phoropter. I've done fill-ins in offices where they have literally the forehead rest there's no space between it, and people are smashed against the phoropter. So adjusting the forehead rest out a little bit helps with the fog. Making sure that you have your face guards on the phoropter also helps. and then making sure their head's appropriately positioned, and then doing either taping the mask or having a patient fold up a tissue and put that under the mask as well too, to prevent more of a seal from air getting through that mask.
So Justin, I have one question here from Dr. Hahn, actually. He wants to ask a live question, so if we can unmute him.
Of a comment. UVC is, as previously mentioned, it is actually only usable for inanimate and inorganic subjects. And if you don't know the power rating, then I consider all UVC products without power rating to be toys. Because if you don't know the power rating, then you don't know the dosage. And with the if they're not part of the GCVID, the UV-GI, pardon me, it's the ultraviolet germicidal irradiation standards of the CDC, then they are not compliant on what the dosage rate. So the safe thing to do is anytime you want to use these toy UVCs is to use it for an hour minimum. If you want to use a room one, minimum 30 minutes because you don't know the power rating. I will absolutely say that none of the manufacturers I've looked at has a power rating.
Thank you, Richard.
Thank you.
And I think that also, just really goes to reinforce the fact that use your CDC approved methods of disinfection first. And if you want to do anything beyond that, including your germicidal UV lights, go for it, but don't rely on it. So thank you for that comment. Terrence, what else we got?
Man, we have so many questions here, Justin, but unfortunately we're out of time. So I'll try to do is field those questions you guys away and hopefully get the answers. But you guys put quite on the conversation, so thank you for that. That was really, really good and insightful. So we appreciate you guys all here being our panelists, Justin, our moderator as well. As you remember, we do this every single Wednesday. We do Coffee Talk every Wednesday. Also part of our Eye to Eye series. As Justin mentioned earlier, we have something that we call Happy Hour. Now, Happy Hour is a little different. We're talking more to the creative side of the industry. So this week, Happy Hour is Friday at 4:15. We'll be speaking with the man himself, Todd Rogers from Todd Rogers Eyewear. This will be an optical speed dating event. So he will be mentoring the next generation of retailers, new retailers, future potential retailers. Feel free to log in, and Todd will be doing one-on-one advice there as well. Now, you may have seen that there's a poll that popped up on your screen. Please don't log off without going ahead and filling out the feedback. It helps us for our future Coffee Talk. Again, thank you all for being here. Justin, our panelists, thank you all from Tucson to British Columbia to Lagos to Barbados. We are signing off now, and we'll see you Friday at 4:15.
Thank you, guys. Stay safe.
Thank you. Bye.
Be safe, be well. Thank you. Take care.
Bye, guys.
Man, that was really good. So Liv, I think that's kind of the record now for the most questions that we've had. The audience is really engaged in this one. Yeah, no, I looked at that. I was like, the questions were just coming left and right. I was like, man, we're going to have to do a part 2 of this. Will, how's it going?
It's good. It's pretty good. Sorry about being a little bit late. I was clicked on the wrong link. I'm like, where's everybody? This isn't working. I had to text Justin. I was like, where? Did I miss an email? What's going on here? So that was my fault. I should.
I saw a couple of these questions pop up. I wanted to kind of address them as we're going, but it was tough because we had just topics back to back. Yeah, I'm glad we got that one doctor in about the UVC. I think that was worth hearing. I think a lot of people want to hear.
Oh, definitely. I actually texted her and asked her if she could share some of that data that we could publish, possibly. I always post.
If anybody's still on, I'm trying to answer some of the questions in the chat that you posted before.
Yep, we've got 65 people still here. So
great. Well, for those of you guys that are still here, I know tonometry came up that I would assume would be one of the questions, and me and Will can probably address that because we both went into getting a diaton. I was using eye care and switching out the probes in between patients, and I've always been interested in the diaton anyways because I do a lot of scleral lens evaluations, but now it just seemed like the right time to go into it. For those who aren't familiar with it, it doesn't touch the content of the cornea. It's actually measuring IOP through the lid, the sclera. So it's actually non-contact to the patient's eye. So it's deemed as possibly one of the safest ways to do tonometry right now. I believe Richard Holm is on. I know he mentioned it in a webinar as well. So we're excited to start using that. I know, Will, you've done it as well.
Yeah, I've been using it for the last couple of weeks, and I think you know, it has a little bit of a learning curve with the staff just because they're not used to a device that takes IOP like that. But once they, you know, it only really took a couple of days for them to get used to it, practicing on each other. And yeah, for me, it's, you know, not touching the eye itself is, you know, the safest way to measure, and getting a very accurate IOP is a very safe way to move forward with it. You know, I know some people are hesitant to use the NCT because of the aerosolizing the virus. You know, whether or not, you know, that's true or not, because I've heard people kind of go either way on that. It's just, if you can, you know, if there are devices out there and you can afford to not take that risk, I would definitely move forward with something like the Diaton, because it's just, you know, especially at a time like this, like I said, it's not just the safety, but it's how people feel about it. And if they're seeing that you're taking extra steps to ensure their safety, those are patients that are going to trust you for life, rather than ones that feel like you're compromising on their safety, right?
Yeah, I see Dr. Brillas. Does it really work? I know, Will, you've been using it. We're going to start using it this week. So I'll let you know how the experience goes. From the studies I've seen, it can be accurate, but there's, not can be, it is accurate. But it depends on how you take the reading. So if you're not positioning yourself, or the staff isn't positioning themselves or the patient correctly, you're going to have an inaccurate reading. So it's just like with anything else, there's training, I'm sure, with it. I believe also, Steve's on here. I believe it's considered PPE. In addition to an 88 tax, I believe it's PPE. So because it's not touching the cornea, I don't know if the other tonometers are classified as that. But
just to add on to what Anith was saying, you know, if you use Goldman and you are, you know, you miss the center of the cornea, that's just as inaccurate, right? It's the same thing. Every one of these devices, the reading is only as good as the person who's performing the procedure. So yeah, if you follow the, I would recommend going on YouTube and watching some videos of people training on that. And that's what we generally did. The video it came with was okay, but once we went on YouTube to see some more training videos, it was actually a lot better. And then everyone was getting much more consistent results, you know, watching those videos. Yeah, that's a big thing, like I said. But just in case, also, I did purchase some disposable tonometer tips as well, too, because, you know, for our glaucoma patients, you know, the Diaton, while it is a good device, you know, you definitely want to stick with Goldman, you know, in that case. And, you know, while, you know, there are a lot of procedures on how to properly wash the tips, I just wanted to be safe and get disposable ones just in case, which generally aren't too expensive. They're about $1 each. I bought like 100 pack. That's definitely going to last, you know, with 3 exam rooms, that's definitely going to last. It's probably a decent amount for, you know, because we don't have that many glaucoma patients. But that's where I would go. In terms of Diaton versus eye care, they're pretty close. I mean, they're both very safe, both much safer than anything else out there. I prefer the Diaton after using it the last couple weeks a little bit more than eye care. I actually also have an eye care as well too. So I can definitely, it's not like I haven't had both. And I had an eye care for much longer, got the Diaton about a month ago. And the staff has been more happy and comfortable using the Diaton over the last couple of weeks because of the safety aspect they feel. And so it may be kind of, at least during the pandemic, our go-to. But, you know, like I said, ideally we would all be able to afford all the equipment, but I know that it's not probably, doesn't financially make sense to purchase every single little bit for every single situation.
I don't know if you guys have to log off or if you're okay. I know a lot of questions came about contact lens training. That's okay to address, or?
Yeah, go right ahead.
Okay. Yeah, so contact lens training, me and Will's been doing the same thing. We're showing them the video, a quick demo in the office, but the patient themselves are not doing it in the office. They're going to be practicing at home. And we've had really no issue with it. We haven't had too many new trainings come in, but we're not avoiding them. And I really have no issue having them see the video in the office, get the quick demo, and then practicing at home. And we still won't finalize it till they got it down anyway. So that's how we've been doing training. The other thing with contact lenses is just ordering. We've been sending everything online. Patients aren't picking anything up. I know there's a lot of services out there for online contact lens ordering. Dr. Contact Lens, I know, is a really popular one that's worth looking into. So again, just going back to utilizing technology. If you're ever looking into those type of platforms, you know, this may be the time to implement it.
Yeah, I think one of the things, a lot of us have been utilizing telehealth throughout the pandemic and the lockdowns that we've had. I imagine that as we start coming out of it, that we're still probably going to incorporate it in our practices a little bit, though not as much as over the past month. It obviously depends on the practice, but I always felt that was a great way, for contact lens follow-ups. If I can avoid getting you back in and we just need to have a quick chat. I've already seen the lens on your eye when you were here. How's the vision? How's the comfort? Everything's good. If something's wrong, obviously you need to have them come in so you can take a look and make changes. But if everything's good, I'm, being able to take advantage of telehealth, and keeping them out of the office as much as possible has helped out. So that's really the only change we've made with our contact lens procedures, just mostly the follow-up aspect of it. Like I said, as with any patient, if you need to see them, you need to see them, because something you obviously with telehealth or over the phone, you don't have equipment and you can't actually see the lens. But if you can take care of certain things away from the office, then that's a great way to do it. So videos beforehand, before they even come in, have them practice, touching their eye so that they're used to it, so they're not spending time flinching too much when you're trying to train them in office, and then telehealth and phone follow-ups.
All right, guys. Well, thanks a lot for sticking around, and thank you for whoever stuck around for the after party. We still have about 50 people still in here. That's amazing. So.
After party is always better than the party, right?
Definitely, absolutely. All right, guys. I'm going to sign out from here. I know things. Will, I appreciate it.
Thanks for having me. Thank you, everyone, for sticking around.
Thank you, everyone.
Have a great day. Bye.
All right, guys. Take care. Hey, Nabil, do you still?